How does tympanic membrane affect hearing loss? Imagine your ear as a finely tuned instrument, with each part playing a vital role in helping you hear. One of the most important parts is the tympanic membrane, or eardrum. This thin, delicate membrane acts like a gatekeeper, converting sound waves from the air into vibrations that travel through the middle ear. When sound hits the eardrum, it vibrates, and these vibrations are passed on to tiny bones called ossicles. This process amplifies the sound and sends it inward toward the inner ear, where it is processed into what we perceive as sound. If the tympanic membrane becomes damaged or develops a hole, known as a perforation, this can significantly impact hearing. The perforation reduces the surface area of the eardrum that vibrates in response to sound. Think of it like a speaker with a hole in it. Less surface means less sound gets transmitted efficiently. As a result, sound waves are not properly converted into vibrations, leading to a type of hearing loss called conductive hearing loss. This means the problem lies in how sound is conducted to the inner ear, not in the inner ear or the nerve itself. The size of the perforation matters a lot. Larger perforations tend to cause more hearing loss because they allow more sound to bypass the normal pathway. For example, a small hole might cause only mild hearing difficulties, while a large perforation could lead to a significant loss of several decibels. The location of the perforation on the eardrum can also influence how much hearing is affected. Perforations in the back part of the eardrum, or involving multiple areas, tend to cause more hearing impairment than those in the front. However, in cases of sudden perforation, the size might be more important than the exact location. Other factors can make the hearing loss worse. If there is an infection or fluid in the middle ear, it can add to the hearing difficulties. Damage to the ossicles, especially the malleus handle attached to the eardrum, can also worsen the problem. The overall health of the middle ear space, including the air-filled cavities behind the eardrum, influences how well sound is transmitted. In cases of mixed hearing loss, where both conductive and sensorineural issues are present, a perforated eardrum is usually responsible for the conductive part. Sometimes, inner ear damage can coexist, making the overall hearing loss more complex. Treating a perforated eardrum often involves surgical repair, called Tympanoplasty, which can restore the membrane's integrity and improve hearing. Understanding the role of the tympanic membrane helps clarify why damage to it can cause hearing loss. Larger and posterior perforations tend to have a bigger impact, especially in mixed hearing loss situations. Always remember, if you suspect a perforation or experience hearing difficulties, consulting a healthcare professional is essential. They can evaluate your ear health and recommend the best course of action to help restore your hearing and prevent further issues.